Okay, welcome back to the mini lecture that I'm currently doing on the integumentary system. This is a part 2 lecture. We discussed the different layers of the skin in part 1 of the integumentary system, but this is going to move us forward with talking about the skin, but we're going to talk about the skin in a little more in detail because this time we're going to talk about the skin and the different conditions or diagnosis that can be made with skin disorders. One of the most prevalent conditions you'll see is skin cancer. That is very prevalent, and this is the reason why it's so important to learn the different layers of the skin because you can pretty much follow what basically transitions from abnormalities and how they develop and basically what they do in order to diagnose these skin abnormalities. You'll see I have skin biopsy up here talking about the collection. And that is what a skin biopsy is. The physician actually goes in and does a collection of the skin tissue. And he's doing this mainly so he can do a tissue examination. He wants to go in to examine the tissue to look for any type of malignancy, looking for cancerous cells that can possibly be a part of the lesion that he's looking at on that patient's skin that appears to be abnormal. So that is the main purpose of doing biopsies in general, but you do biopsies basically to look for the malignancies. Okay, you're just trying to detect what type of cells are growing in that skin that appears to be very abnormal looking. Now, there's 3 types of biopsies that are very common, as well as I would say 4 rather, but let's talk about the top 3 first, and we'll talk about the 4th one as well. The first one I have up there is called a punch biopsy. What a punch biopsy is it's a collection of tissue, and what they're going to do is take about the size of an eraser. It's very small. It's a circular type of device. They're going to punch it down onto the hand, on the back of your hand or your arm, or wherever he feels that's going to be a good area to take that biopsy from the skin that's appearing abnormal. And that is why it's called a punch biopsy. They punch down onto the skin and extract that skin, which is about small centimeters, and send it in for testing. The next biopsy is excisional biopsy. Now, when they do excisional biopsies, this is when the physician actually wants to remove the whole lesion. Okay, he may particularly want to remove the whole lesion or the whole mass, and they go in basically to do this because they want to remove that entire lesion so they can send it in for testing as well. Keep in mind with the NCLEX, you need to know that excisional biopsies, those are more required when you have a mass that's sitting pretty deep into the skin. Okay, it's not really superficial. It's past the epidermis layer that we talked about in the previous lecture. So the excisional biopsies are more larger, they're much larger, and they are much deeper into the skin. Okay, and matter of fact, when they are deeper into the skin, they will have to do a certain level of cutting, excising through into the skin. So sutures will be needed with that type of biopsy when you're talking about an excisional biopsy. Now, when you move into the next biopsy, that's called a shave biopsy. Shave biopsies are typically removed when you have a lesion that's sitting directly on top of the skin. It's not penetrating into the skin layers. It lays on top so they can take a device and completely shave that lesion off and again, send it out for testing. So the punch biopsy and the excisional biopsy and shave biopsies, they're very different types of biopsies on their procedure and why they're using a punch biopsies versus sometimes an excisional, or they may just simply use the shave. Another type of biopsy they do to examine abnormalities of the skin or anything that could be internally. They will do a needle aspiration biopsy. This is when they're using a particular device, kind of like a needle, but it's a needle that's going to go in that particular area. It could be anything going into the pelvic region, okay, in the abdominal region, and they're going to aspirate the tissue cells because they want to see if those cells are cancerous. That's a different type of biopsy. It's not particularly aimed at the skin. This is something that they usually do internal, okay, when they're suspecting a type of cancer that may be in the uterus, abdominal tract, something of that sort that may cause them to have to go in to get the cells around that organ or in that cavity where that organ sits or anywhere that may be just invasive. Okay, let's go ahead and move forward and talk about the important protocols. There's important protocols for biopsies. And one thing that the NCLEX wants every nurse to know, they want you to know you must always obtain, okay, an informed consent from that patient. Okay, though in general, the doctors are the ones who typically explain, okay, that informed consent to the patient. Okay, this is something that's important under the protocol that it must be done. Okay, so that's something you can always give a reminder to a practitioner, and just in case they forget to obtain it, you know, and the NCLEX wants you to know that an informed consent must be taken before you do any type of biopsy on any type of patient. Okay, that's very important. Another thing you see I have on the board here is about sutures. Okay, I did speak about the incisional biopsy where it sits deeper into the skin and it's going to require that physician to go down into the skin and to basically cut that lesion out of that skin. Well, again, when they use sutures, always keep in mind sutures must always be removed during a certain time period. So sutures should always come out within 7 to 10 days, okay, after that procedure has been done. Let's go ahead and move forward and talk about skin cancers. Since we've talked about the biopsies and why they do biopsies, which is for abnormal skin appearance and tissues that appear to be abnormal. Well, one thing, like I stated, skin cancers are prevalent, and you need to know the top 3 skin cancers that's very well known out here. They have one called the basal cell cancer or basal cell carcinoma, you can call it, because it is a cancer. But this cancer, basal cell, it appears pearly. Okay, this is like a pearly, shiny type cancer. Okay, and you'll see it has those type of pearly borders. We'll see pictures of that in a future lecture. But a basal cell cancer is very well known, but this is not a cancer that is known to metastasize. This is a cancer, it's not invasive. And basically I want you to know too is that the basal cell cancer usually affects the epidermal layer. So when it affects the epidermis, that means it's superficial. It's going to lay on top of the skin. Okay, this is not a cancer, again, that infiltrates inside. Okay, the next cancer I have up there is the squamous cell cancer. Squamous cell cancer is known to be a malignant type cancer that definitely can metastasize. This is a cancer that can become aggressive and it can definitely move. Okay, it can move and infiltrate on the tissues. Squamous cell cancers have a different type of appearance because it appears more like a crusty-like lesion. That's what they look like. It looks like something's oozing out of the lesion. Okay, like it has an exudate, okay, pus-like forming type of lesion. And that's what a squamous cell cancer looks like. But it can also become, okay, it can become malignant. And when you're looking at squamous cell cancers, they're known to metastasize, well known to metastasize to your lymph nodes. So that's important to know about those squamous cell cancers. Just keep in mind, these are crusty-like lesions. And when the NCLEX describes those skin cancers, you should know the difference between the basal cell cancer being a pearly, shiny like border cancer versus a squamous cell cancer having more of that type of crusty lesion that has exudate or pus oozing out of it. Those are more nasty like looking type cancers when you talk about squamous cell. Let's move on into another cancer. This cancer is very well known. This cancer comes out of a lot of patients that tend to lie in the sun, through tanning booths. You'll see this. This is coming from those powerful powerful UV rays coming out of the sun, there you have is melanoma. Melanoma is a cancer that has to be watched closely. This is a cancer that definitely will metastasize. It's a cancer that looks like no other type of skin cancer because the melanoma cancer appears to be more like blackish, tannish, bluish. It has a different type of coloring. It's kind of irregular shaped, but it's also circular shaped. So this kind of cancer will stand out to you. Okay, again, it comes in different types of colors. So it distinguishes itself from the basal and the squamous cell type of cancer. Okay, now one thing the NCLEX wants you to know as well is that melanoma skin cancer, it produces like those moles. Okay, and this is something that should bring an alert when you're looking at a patient. If they appear to have moles on their body, especially in the lower extremity, because this is where melanoma likes to settle onto, is the lower legs. When you see moles looking abnormal or just seeing moles in general, you want to bring this attention. And this is what the NCLEX wants you to know. That should be brought attention to the physician. Okay, so they can look at it, observe it, and probably do a biopsy on it just to see if this possibly could be melanoma, because melanoma does present itself as a mole. Okay, it can be deadly. This is a cancer that definitely can infiltrate, and it's aggressive. Once it infiltrates the tissues, it can move. It can metastasize, and it definitely can move to the areas that you see I have on the board. It can move to the BBs, and it can move to the LL organs. Those BBs will be the brain, and it can move to the bones. The metastasis can go to those areas, but it can also move to the organs of the L's, and that's going to be the liver and the lungs. These are the four major sites of the organs that melanoma typically goes to: the brain, the bones, the liver, and the lungs. And this is why melanoma is one of the well-known cancers among skin cancers that you must observe. Okay, now what you see also on the board that I have here is that nurses must always educate their patients. The NCLEX wants you to know that you should be tuned in to how to educate your patients about melanoma. They need to do monthly skin checks. These patients must know they need to always observe any abnormalities of warts, moles, anything that looks abnormal, especially on the lower extremity. Okay, and these checks should be done monthly. Okay, another thing about with nursing educators and nurses that are giving patient teaching, they should also let their patients know that a lot of times these moles, they look like sores and sometimes they don't heal. Okay, that patient needs to be aware. If they see something not healing properly, okay, they need to alert you as the nurse, and they need to alert the physician. Okay, this pretty much sums up what we're talking about here with the different types of cancers and the things that you need to be looking out for, and the biopsies, okay, and the purpose of why these biopsies are done. Because of these skin cancers and because of just cancerous cells, of why these biopsies can pick up these abnormalities. Okay, keep in mind another tidbit I would like to put in there is with melanoma and just skin cancers, period, is that basically they recommend for patients that that go out into the sun and they like to get tan and they like to do tanning. Well, the NCLEX wants you to know in nurse teaching, you need to always inform your patients that the best time to avoid, okay, the hottest UV rays that's outside when they're tanning is between 10 o'clock in the morning and 4 o'clock. Those are at the highest peak, okay, of the rays that are very dangerous on basically penetrating onto the skin and causing these harsh abnormalities of the skin that may develop into cancer. Okay, this completes it for part 2 on the integumentary system of the skin biopsies, the different types of biopsies like we discussed, the punch biopsy, the excisional biopsy, and the shave biopsy, as well as the needle aspiration biopsy, and also the 3 top major skin cancers: basal cell cancer, squamous cell cancer, and the malignant one that's known to be malignant, just like squamous cell, would be melanoma. Thank you for attending this mini lecture, and this is Excel Nursing Tutoring, and please like and subscribe. There will be more videos coming to explain different topics on helping to pass the NCLEX. Thank you.